CAR-T therapy is a promising immunotherapy to treat refractory and relapsed malignancies such as non-Hodgkin lymphomas. The off-side effects of CAR-T immunotherapies may affect the kidneys. Therefore, identifying risk factors for acute kidney injury among patients receiving CAR-T therapy could enable preemptive management to help to reduce the incidence of acute kidney injury and its subsequent adverse outcomes. My name is Sandra Herman, and I'm Associate Professor of Medicine and one of the nephrologists at the Mayo Clinic, Rochester.
I am Elin. I am a hematologist at Mayo Clinic, Rochester, and the medical director for the immune cell program here for Mayo Rochester campus.
Today, we are presenting the article, Incidence and Risk Factors of Acute Kidney Injury Following Chimeric Antigen Receptor T-cel, or CAR-T therapy, and this article will appear in the upcoming issue of Mayo Clinic Proceedings. In this study, we retrospectively review records of 83 non-Hodgkin lymphoma patients treated with CAR-T therapy at Mayo Clinic, and these patients are followed up for 1 month after the treatment. The key finds of these studies were the following. Acute kidney injury is not that uncommon. It can occur in up to 70% of the patients undergoing CAR-T therapy. But the good thing is that most of those cases are mild cases of stage of acute kidney injury. And over 70% of these cases resolved by the end of 1 month. The most important risk factors to develop acute kidney injury in the first month were lower baseline kidney function, the use of IV contrast, patients that required tumor lysis prophylaxis medications, possibly because their physician assessment were that these patients had a high tumor burden prior to the CAR-T infusion, were the ones with a higher risk to develop a kidney injury. And we also noticed that patients receiving higher dose of corticosteroids and interleukin-6 blockades, such as tocilizumab, which are medications we use to treat cytokine release syndrome and neurotoxicity, were also the ones who higher risk to develop acute kidney injury. Therefore, patients with those characteristics should be close monitoring for the development of acute kidney injury.
I'm really glad to see the work by Dr. Herman, which is highly relevant for how CAR-T could be used in standard of care practice. We know in the registration clinical trial that led to the approval of CAR-T, those have to be done very rigorously, which include patients with absolutely normal kidney functions. And in the real world, our patients are older. They can have aggressive disease. They may have had prior treatment that already predisposing their kidneys to injury. So these are practical things that we need to take into consideration. So it's very encouraging to see that in our standard of care practice, in our real day-to-day patients that we see, that overall the safety signals in terms of any acute kidney damage and likelihood for complete recovery is very good. But I think this also highlights that there are still additional opportunities on how we can continue to improve the experience of these patients going through treatment. So even how we can potentially further reduce the risk or optimally manage them through some of these acute complications, which may involve electrolyte abnormalities and even though transient kidney damage, but those could have real implications for escalating the management in inpatient versus how we can try to keep patients outpatient through their treatment and management journey. So I think this study highlights very importantly what we're doing now. And so in our current practice, we identify patients that may be coming in with these risks and engaging with our nephrologists, onconephrologists. We even have a clinic now with onconephrology, and we really try to engage their expertise early on so that they can be involved through the treatment journey for our patient and really try to optimize when we can the overall their health status and going through the treatment. So not only is it that they can survive and be disease-free, be cancer-free, but they're also enjoying that with their best organ functions.
So the next steps on our research is to do prospective studies involve serial collections of laboratory measures after initiation of CAR T therapy to validate those findings that we found in this retrospective study. Therefore, we invite you to read the full manuscript that's coming up in the issue of July 2022.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.